Let's talk about termination of pregnancy. I decided to choose this particular topic simply because there's still a lot of women out there who do not have information with regard to termination of pregnancy, and most of them end up going for unsafe abortion, which is very, very dangerous because you can lose your life. You can end up losing your womb because of unsafe abortion. So here in South Africa, termination of pregnancy is allowed. There is an act which regulates that, the so-called choice on termination of pregnancy. So according to this act, any pregnant woman, irrespective of the age, they can actually request a termination of pregnancy, particularly in the following circumstances. If that particular woman is still less than 12 weeks pregnant, they can actually request termination of pregnancy. So from the 13th week to 20th week of pregnancy, if a medical practitioner, after consultation with this pregnant woman, is of an opinion that the continued pregnancy would pose a risk or injury to the woman's physical or mental health, then that particular pregnancy can be terminated. And also, if there exists a substantial risk that the fetus or the baby inside would suffer from severe physical or mental abnormalities, that pregnancy can still be terminated. For instance, if the mother is known to have taken certain drugs, it could be medical or illicit drugs early in pregnancy, that can actually affect the mental status of the baby after delivery or cause any physical abnormalities, that pregnancy can be terminated, but this will be after consultation with this particular woman. So the woman has to be agreeable in order to terminate that particular pregnancy. So between 13 and 20th week, still, if the pregnancy is as a result of rape, termination of pregnancy can still be done. And also, if this pregnancy is deemed to be or it's significantly going to affect the social or economic circumstances of this particular woman, then pregnancy can still be terminated between 13th and 20th week. But in this case, you obviously will have to involve social workers to make sure that indeed this pregnancy will affect this particular woman socially and economically. So from 20th week upwards, the pregnancy can still be terminated, but yeah, it's not on maternal or on mother's request. In this case, a doctor will consult with another doctor or a trained midwife. So if they realize that if this pregnancy is continued, it will definitely endanger the woman's life. For instance, if you have high blood that is not controlled, or you have heart problems and all those things, that might actually put the woman at risk of losing their life if the pregnancy is continued. So the woman will be cancelled for termination of pregnancy if it's above 20 weeks. And also, if there is a risk that this pregnancy would result in a severe malformation of the baby, and the pregnancy can still be terminated. So termination of pregnancy can be done at a clinic where there's a trained nurse, or at a private doctor, or at the hospital. So all those facilities are available for women to do termination of pregnancy in a safe manner. So in terms of complications, the complications are mainly related to unsafe abortion. Because remember, if this is done by someone who does not have knowledge about this whole thing, you can end up bleeding during the procedure. They may end up perforating or perforating the uterus, with injury to the bowels and all the surrounding structures there. And also, if they don't clean you after termination of pregnancy, all those products that are remaining in the womb, they end up catching infection, which can be very dangerous to the pregnant woman and also to the partner of that particular woman. So bleeding is another complication where a woman can actually even lose life